Think of your leg veins as quite one-way delivery system. Every day, without noticing, they carry blood back to your heart against the gravity's pull. It's not a small job. Over a lifetime, it's one of the most hardworking and least celebrated systems in your body. When that systems fail, when a valve stops closing properly, the usual answer by doctors is wear compression stockings. Simple, non-invasive, sounds like it should just fix things. But here's what, even researchers who studied it closely, a compression stocking isn't doing one job. It's quietly doing 7 different jobs at once. Some working beautifully, some barely working at all. And most people, including many clinicians, assume it's mostly doing one job it's actually worst at. I went through a lot of vascular literature, studies from teams like Partsch, Dr. Mosti, Dr. Lord, and many other literature. In these studies, these doctors used ultrasound, MRI, and even tissue biopsy analysis to see actually what's happening in the veins when patient is lying down, when patient is standing. What they found was something which will reframe the whole conversation altogether. This isn't about saying that stockings don't work at all. It's about understanding exactly what they are doing for you, so that when they are not enough, you know it's not because you did something wrong. It's because compression was never designed to fix a broken valve. It was designed to cope up with the symptoms of varicose veins. I am Dr. Ashish Sarode, a vascular and interventional radiologist. Most patients, and honestly, a lot of doctors, think stockings work through one simple mechanism: squeezing the vein, pushing the blood up. That's an oversimplification. In reality, there are 7 distinct mechanisms at play. Let's go through each one of them. Mechanism 1, reduction in vein diameter. The first is the most commonly cited mechanism. External pressure narrows the vein. Picture a garden hose pipe. Pinch a part of it and the water will flow through the narrow section with a lot of speed. Same volume, smaller space, but a faster speed. This is well demonstrated on ultrasound, but almost only when the patient is lying flat. The moment the patient stands up, this effect is largely lost and disappears. Dr. Lord, Dr. Hamilton, in their study found out that compression stockings with pressure of approximately 20 to 30 millimeter mercury, which is class 2 compression stockings, do not compress the leg veins in standing position. They do so only when the patient is lying down, supine. Similarly, Dr. Partsch and his colleagues also found that the pressure required to compress a vein when the patient is standing is approximately 80 millimeter of mercury, which is something which a compression stocking will not deliver. Second, valve function. Your leg veins have one-way valves. In venous disease, these often fail, not because they are structurally broken, but because the vein around them has dilated. So the leaflets cannot meet each other in the middle and seal the vein. The theory is the narrowing of the vein with compression brings the leaflets back together. It is inconsistent, and in severely dilated veins, this mechanism essentially fails all the time. In the same study which I cited before, Dr. Lord and Hamilton found that in varicose veins, specifically the main superficial vein of the mid-calf, wasn't even compressed when lying down, suggesting leaflet coaptation isn't restored once the vein has dilated significantly. Third, and this is the strongest of all and has the strongest evidence behind it, compression acts on the tissue surrounding the vein, not just the vein itself. Fluid consistently moves from your capillaries into the tissue space adjacent to it. Compression raises the pressure there, opposing the fluid leakage from the capillaries, which means that the swelling will become less. This effect does not depend on position, and it works on lying and standing as well. Because this is happening at tissue level, it is the most consistent of all the mechanisms we know which work for compression stockings. Fourth, calf muscle pump, sometimes called as the second heart of your body. Walking makes your calf muscles contract and relax, squeezing the blood veins, squeezing the deep veins and propelling the blood forward. Stockings are thought to give the calf muscle a firmer surface to push against the contraction, improving the blood ejection in each step. Also, it improves the efficiency of the calf muscle pump, that is your calf muscles. The catch is this only works if the patient is actually walking. Sedentary, immobile patients will not get any benefit from this because they are actually not using their calf muscles. Fifth, graduated design itself. Highest pressure is at the ankle, which decreases once you go upwards towards the thigh, meant to encourage the upward blood flow. But this only works with a correct fit of stockings. A wrong size, wrinkled or rolled down stockings will not have a gradient and will completely lose the gradient. Sometimes a tourniquet effect can happen, which can worsen the pooling and worsen the swelling. Sixth, long-term compression is believed to lower the ambulatory venous pressure, that is the pressure in your veins, which builds up on standing and walking for a long time. Chronically high venous pressure drives the skin and tissue damage seen in advanced venous disease. But this requires near daily, consistent, long-term wear of stockings, genuinely difficult for most patients to sustain. And seventh mechanism, a very less widely known mechanism. Chronic venous disease has an anti-inflammatory component at the vein valve. Some evidence suggests in some researches they have found that compression may reduce the inflammatory activity and reduce the inflammatory markers, which improve the vessel wall health. So of these 7 mechanisms, only 2 are genuinely reliable regardless of position. That is reduction of tissue swelling by compression stockings and enhancing the calf muscle pump efficiency when the patient is actually walking. The mechanism most people assume is doing heavy lifting, that is directly squeezing the vein narrower, is actually the least dependable of all. And once you are upright and moving through, this actually fails. That's exactly why stockings help many patients feel better with less swelling and less heaviness while doing very little to correct the actual structural problem of varicose veins. Because they are not designed to fix a broken valve. They are designed only to reduce your symptoms. So if you have worn stockings for months and years without structural improvement, that's expected based on what we have just covered through a lot of studies and literature in the research. Compression stocking manages symptoms, but it does not fix the faulty walls. So if you know what's actually happening to your veins, what is actually wrong with your veins, duplex ultrasound is the first step you should take. So you will have to book a consultation with vascular and interventional radiologist who can do a very detailed Doppler scan, which will show what is actually wrong, which walls are actually abnormal, which walls are actually faulty and not working. If this helped you understand the science better, please hit the like button and subscribe for more such evidence-based content on varicose veins and many other diseases which are treated by an interventional radiologist. Thank you.